Okay, there you are. Okay, now so today we shall be talking about the iTera-Bio and the iTera-Bio Lite. All right, so both of them are about the same, but we shall know what are the differences later. Now, welcome again. Now, 70% of population are suffering from sub-health status. All right, they're going through lots of problems, especially fatigue, anxiety, headache, and dizziness, and also the inability to concentrate, and they have memory loss and gout, which is troubling them, and having heaviness of body. And they're also suffering from bloating, abdominal pain, indigestion, constipation, and a low body temperature, and also fatigue. And besides that, irregular menstruation is also troubling them, right? So now lots of people are using the iTera-Bio, right? And also the BioLite, which we shall see later, right? To alleviate their problems. And how do they do that? Before we see that, we look at the device itself. It's very comfortable, elegant, and effective. All right. All you have to do is just sit, put your feet inside, switch it on, and it's working for you. All right. So the design is elegant, and if you see, it has a self start and self control. I mean, for you, which controls the heat level according to your comfort level. Now, talking about the heat level, I would advise you start at around 5, all right, and then slowly bring it up or bring it down according to how comfortable you are. And then, if you have a diabetic problem, then you should start probably at around 3 and then slowly work yourself up, all right, because diabetics, their heat receptors may not be working as good as they should. All right, so sometimes they don't feel the heat. So if you're bringing someone, ask them if they have got diabetes and start with 3 and you'll be good. All right, so this is the remote control where you can use to increase and decrease the amount of heat. It works from 1 to 10. Right, then you also have IMD or in-mold decoration on the device. So everything is there. It's very smooth and elegant and nice. And you will find that, what do you call it? It activates. What the iTera-Bio does is, and also the BioLite, what it does is, it activates the cellular energy, right? It increases metabolism, it relieves inflammation, purifies the body, he helps with body shaping and anti-aging. Some people will tell you reverse aging. And then it alleviates the cold and dampness. And also it's a diathermy fat burner. And it definitely is activating the cells so that they start functioning again. And it's promoting circulation, especially to those people who have a poor circulation, right? So these are all the things that the iTera-Bio and the BioLite can do, right? So it warms your body as well as you sit there. In about 30 minutes, some people will swear that they are having sweat, all right? Even if they are in an aircon environment, they say, I'm sweating, right? So it warms your body. That means the circulation has improved inside. It warms up your body inside and out, dries away the cold and dampness, and gets rid of blockages to rebuild a healthy you. Now, when we say it's getting rid of blockages, now basically what happens is many people will have a problem with their blood circulation, and then their blood vessels may not be as good, as clear and good. So what it does is it helps to push the blood through those vessels. And so initially you might find that even reading of 6, the heat level 6, might be difficult for you because now it is trying to force its way through, clear the path for you. But as you keep using them, over time, you'll find that you are slowly going up to 7, 8, 9, and even 10. So what it does, it clears the path for you. All right. So it clears the blockages for you. Okay. And then if you use 15 minutes a day, just 15 minutes, but go for 30 minutes, it's as good as 60 minutes of aerobic, 8 hours of massage with bare hands, 60 minutes of sweating, 30 minutes of gua sha, 180 minutes of moxibustion, and 20 times of cupping. This is what people say, all right? And it's definitely improving circulation and stimulating cellular immunity. Basically, the immune system is activated, it improves the circulation and even the microcirculation. All right. So for people who have got neuropathy, we shall see about it more later. The neuropathy. So slowly it brings back people from neuropathy. Right. So there are basically three core technologies involved. The first one is, of course, the terahertz energy, and it has potential health benefits. We say potential because we are not doctors here, and it can detect diseases. You can know that where the diseases are. You can feel them, and then it improves wound healing and enhances drug delivery. And it has definitely been helping people with remarkable health recovery. So people who have been using it daily for about 30 minutes will tell you how they have recovered. All right. So then the second energy which this bio has is that it has got negative ions which can provide numerous benefits such as boosting mood, improving respiratory function, and increasing energy levels. All right. And negative ions are also known for reducing stress and anxiety, improving cognitive performance, enhancing immune function, improving sleep quality, and reducing the severity of allergies and asthma symptoms. All right. And these negative ions also play a big part in alleviating free radicals. All right. So the next thing you see here is the graphene far infrared heat therapy, which can provide numerous health benefits as well, such as reducing muscle and joint pain, increasing blood flow and circulation, promoting relaxation and reducing stress, improving flexibility and range of motion, and aiding in the recovery of certain injuries. So the warmth that you feel is partly because of the graphene far infrared heat. And what it does is it carries that heat to throughout your body, through your vascular system. All right. So it has got triple energy for better effect. Now, what are the main functions of this? How do they really work? We go a little bit deeper now, right? So the first thing is elevation, where it alleviates cold and dampness and relieves inflammation. Okay, what's happening is it helps dilate blood vessels, reduce blood flow resistance, right? Part of the heat which you cannot withstand beyond 6 is because of that resistance. So what it does is it clears that resistance and slowly you'll move up. And also blood viscosity, it brings down the blood viscosity. It can improve microcirculation and increase the ability of oxygen storage and carbon dioxide elimination to allow the transportation of nutrition to the whole body. So as such, our organ functions and immune system can be restored to optimum level and therefore reduce our chances of getting diseases. All right. So you are preparing yourselves to avoid diseases. Now, if you look at this, these are the various problems you go through, and he's helping them to alleviate that. Now, besides that, it's also helping to purify the body. What it does is it accelerates the blood circulation. So the blood speeds up a little bit, rapidly metabolizing and eliminating acidic substances in the body. It's also helping to alkalize the blood because it's removing the acidity. It catabolizes the cholesterol and triglycerides and other substances clinging to the blood vessel wall and improves the internal environment. Imagine you have a drain and there are things which are sticking to that. The water is flowing slowly. Now, when you increase the speed of the water, it's able to wash away whatever is clinging to the drain. All right? So something similar. So you'll find that it is clearing stasis and blockage. It detoxifies colon, and then it's also helping with fat burning, and it eliminates toxins. All right? Okay, now besides that, it's also helping with body shaping, okay, and fat burning. It acts on motor nerves, encouraging the rhythmic contractions and relaxation of muscles to accelerate blood circulation and nutrient metabolism processes of muscle tissues. And as the muscle works, it burns more calories. Now, to improve muscle strength, prevent muscle atrophy, and promote nerve regeneration and transmit impulses to the central nervous system. Now, this has also got to do with neuropathy, where neuropathy actually blocks the nerve impulses, all right, to the central nervous system. So here it is helping to alleviate that problem. Now, it breaks down fat cells in the body, it eliminates toxins, helps body fight and eliminate free radicals, and it's also helping you to look younger, right? And it nourishes the spleen and stomach, replenishes the chi and blood circulation, and restores normal metabolic functions. So when your metabolism starts improving, you're burning more calories and the weight starts coming down. All right. So even the visceral fats, we will see they are slowly coming down. Okay. They're burning them. All right. The next thing is beautifying people. People are finding that they're getting more and more beautiful, right? Not only anti-aging, but reverse aging. People are beginning to look younger. It removes freckles and wrinkles, removes dark circles and eye bags, and the skin becomes more radiant and elastic. The skin becomes lighter, moist, and rosy. And detoxification happens where it accelerates metabolism, activating blood and cells, and regulates the body from the inside out. Right? And people start seeing a new themselves. All right. So the combined energy can activate cell vitality, stimulate collagen regeneration, delay skin aging, and it smooths wrinkles. So you will see that slowly your wrinkles are slowly disappearing, the lines are slowly disappearing, and you start looking younger, right? And it's also a form of heat therapy. There's this warming effect where the heat can penetrate 3 to 4 centimeters under the skin and is easily absorbed by the tissues of the body. Okay, and it rapidly increases the surface temperature and accelerates the subcutaneous blood circulation. And this is where you start seeing sweat coming out, right? It relieves muscle tension, relieves pain, and regulates the autonomic nerves. And it increases metabolism, enzyme activity, and promotes vasodilation. And the it helps with microvascular permeability. It helps to discharge waste. Right now, you find that even the lymphatic system starts functioning and it accelerates wound healing because now it's able to clear the toxins and waste. Right? And it increases the muscle contraction ability and it relieves the pain and muscle spasm. So indirectly, the muscle cramps start going down, right? And it reduces blood viscosity and reduces the stiffness and discomfort. You know, when you wake up, you find that there's stiffness in your legs. As you use this, you'll find that the stiffness starts going down, right? Now, it's also antibacterial. The bio is antibacterial. The BioLite does not have that feature. So far, whatever I said is both for bio and BioLite. So for the bio, it has also got this antibacterial and wellness feature, where it has got more than 10 million negative ions. And then it helps with deodorization and sterilization. And it also helps with odor, fungal infection, athlete's foot, and sweaty feet because of the negative ions. All right. And it has a spa effect for the foot, the feet actually. You're using both your feet. All right. So now uh, you just have to sit down, put your leg in, relax, and continue what you're doing, right? And it's definitely necessary in certain areas, especially when you have cold and dampness body conditions, for office workers, for postpartum mothers, for obese people, for beauty lovers, middle-aged and elderly people, sitting or standing for a long time, and people with hypertension, high cholesterol, and high blood sugar. So it's really necessary for you. It's definitely going to help you. And it's also suitable in certain areas, especially where you have for home use. Now the whole family can use that. And then, especially when you have tired legs and you have some, pain, all right, you can use that. So you can also use in therapy centers. People are coming, sitting, using the device before they go on. And then you can use in beauty salons. Now, beauty salons, when you use this, you have an added advantage. So people are going to constantly come back to you because you've got something extra compared to the rest, right? And spa centers, rehabilitation centers, activity centers, and in offices, right? So, people are generally stressed in offices. I've seen many workers where they're really stressed. So after about 20, 30 minutes or even for lunch break, you just come and sit using the device and then go back to work for the rest of the day, feeling more refreshed. All right. So companies will cut down on MC, all right, medical certificates. People are less prone to getting sick, right? Okay. Now, so you have also the iTera-Bio Lite. Now, basically, they have all the features which I mentioned just now, except for probably two features which are probably not there. All right. So the comparison here. Now, basically, we have everything except that the BioLite does not have the negative ions and the sterilization and deodorization food, what do you call it, feature. All right. So other than that, it's all good. And the other thing is the iTera-BioLite is the second generation device, and the iTera-Bio is a third generation device. All right. So they still have the smart chip control, but then it's all up to how much you can fork out, how much budget you have. So you choose which is best for you. All right. Now let's listen to just a little bit on the Bio and BioLite. Device.
While using this
While using this.
All right.
So ideally just switch on the TV and watch a drama or a movie for half an hour. All right. So because otherwise you're going to interfere with the system. And then some people feel that while their leg is on this, then they have another, what do you call it, blower, which is they're using on them. No, I would recommend not to.
At the same time,
yes. Why?
Okay, why?
Because this energy is now trying to go and bring about the thing very nicely, and you're disturbing that flow by bringing another one to one part of your body.
So what if, let's say, they have completed the 30-minute sessions, and then they want to continue with iTera-Bio?
What we tell people is, the system, once it works for you, give a rest of 4 hours.
Oh, okay.
Why? Because in that 4 hours, your cells which have been receiving that energy, they will rebound. They'll go to the next level. So before they rebound, you're giving in more, and here more may not be good.
Oh, okay. So
right?
that...
Now, I'm sure you've heard, every time you use the blower, they're telling you, after use, and then after 4 hours, you can use again. Correct?
Yeah.
Why? The same principle.
Oh, right.
Because the body has to rebound. The cells have to rebound. Our body is not like other machine where they come up, they stay there. When you push them up, some things are happening inside. When you rest, that's when they move up. Okay, there you have it as to how to use it. So I hope, so this is the best practice for the bio and the BioLite, right? So let's see what are the contraindications for using this, right? Now, first of all, pregnant moms, children below the age of 10, and then you're having a fever. Okay, try not to use this. And then you have people who are unconscious, right? If they're not conscious, then please do not use this device. And then you have, what do you call it, the things, what do you call that? I forgot the term suddenly. Yeah. So things which are put into you, pacemakers, right? Pacemakers, right? So you may not want to use this device if you have pacemakers. And then you have lung disease, infections. You may not want to use this. And then you have cataract, what do you call it, lenses and cataract lenses. Okay. And you have bleeding. You may not want to use this. And also you have, what do you call it, insertions in your body, especially if they are metal, for the fractures and all that, because when they are hot, they're too hot, then they can expand and pull the fracture apart, right? So you wouldn't want to use them, okay? Now let's look a little bit deeper as how this works. Now, how the terahertz frequency works in the body. So first of all, it is activating the health cells, right? So it's activating the health cells. I shall not go deeper today. Maybe another day we will talk in detail. And then it also repairs the damaged DNA, right? It goes even to the aspect of DNA, okay? So it's repairing it. And then it also restores and rejuvenates the cells. And then it increases energy and vitality, especially with the ATP production. As we know, ATP is important for energy. It boosts energy and vitality again, and it supports detoxification, right? It eliminates free radicals, flushes out toxins and waste, and enhances lymphatic flow. So the terahertz helps with this. Then you're looking at the graphene infrared as to how it is helping. So it restores the organ functions. It helps to detoxify. It supports cellular repair, again with cellular repair, right? And then it relieves muscle and joint pain. Okay, the heat helps in a way. It boosts circulation and it promotes detoxification as well, together with the terahertz. They work together, right? So we are not. I'm just separating to see what they do, but then they work together, right? So the next thing is the negative ions. Let's look at the negative ions. They boost the mood and reduce stress. They improve the respiratory health. The feet absorbs the negative ions, and then they go up. Supports cellular energy, right? It's also in a way helping to alkalize the body and then combat fatigue. It detoxifies and purifies the blood, and it's also boosting the immune function. So when you have these three energies combined, they're working fantastically. And of course, in the BioLite, you don't have this feature, right? Okay, so put together, this is how the iTera BioLite works. Okay, first of all, you need to put your feet firmly on the board. It doesn't work with just one foot on the board. You need to have both together. Only then the device works. And some people have even asked, what if I use my hands? No, it's not designed for your hands. It's designed for your feet. So please tell everyone to use their feet. All right? They stay there until the end of the therapy. Okay? So the energy penetrates upward through your feet and the cells where the absorption begins, right? And the circulation starts having a boost. And then the muscles and tissues, they have deep heat and relaxation, and they start detoxification, right? Your lymph flow becomes better, and you start sweating, removing some of the toxins, and then the rest will be taken out through maybe urine, All right, and then the organs and core, they start having better balance and recovery, and the full body wellness. You have pain relief, energy, and inflammation. So what happens is, as energy flows up from your feet, you have better circulation, cellular repair, and total body benefits. All right. So this is how they move through the body. Okay, from the feet up, they start moving through your body and through your muscles, through your bloodstream, to the cells and organs. So it's helping with recovery and healing. So this is how it works. All right. So the next thing is, uh, now let's go on to tips. Right. Now, how many of you have neuropathy? And then how many of you know people who have neuropathy, who are suffering from neuropathy? Maybe they have diabetes or for some other reason, and they're troubled by that problem. All right. So today's tips will focus a lot on that. Okay. We shall see first about neuropathy. So neuropathy is actually often multifactorial, meaning there are several causes which may act together. Because I see many, many people going through this, suffering. Almost everyone we meet, especially when they've passed the age of 40 and closer to 60 and above, they have some form of problem. And then not knowing what exactly is troubling them, and they're taking all kinds of supplements, medicine, and still not knowing what's affecting them. So today we shall see how this works on them, right? So neuropathy is actually damage to peripheral nerves, which are nerves outside the brain or spinal cord, and they affect sensation, movement, and even organ function, right? Now, what are the problems people face with neuropathy? Now, first of all, sensory problems, which are the most common. Okay, they have numbness on their legs and feet. They complain of numbness, not knowing that it's a nerve problem. They have tingling of pins and needles, and then they have burning or electric shock pain, and then they have sharp stabbing pain and extreme sensitivity to touch. All right, even pulling up the bedsheet sometimes hurts them, and reduced ability to feel temperature. Now, this is the biggest problem you have to worry about, especially when you're using devices which are a little bit of heat. And then loss of vibration or position sense. You can see them imbalanced sometimes, all right? And for some people, the legs, you feel like you're walking on sand, and then you're wearing socks or you're wearing invisible gloves, all right? So they have that feeling, okay? Now, the other aspect is which involves movement and muscle problems, especially have muscle weakness, not knowing why I'm weak, and then difficulty walking or balancing. Suddenly you find that you're moving sideways, the foot drop. Suddenly the foot is, you're unable to lift that foot, and then you have cramping or twitching muscles. So most of the time people are telling you probably you are missing magnesium. Probably that is also part of the cause, but here the nerves may also be playing a part. All right. So loss of coordination, right, and muscle wasting in severe cases. Right. You start suddenly becoming thin. You're starting to lose protein, and then in adults they call that sarcopenia. Right. So it also can affect your autonomic or internal organs, and damage to nerves controlling automatic body functions. Things which you do normally, but now you find it difficult to do normally. All right? And then dizziness when standing. If you suddenly you have low blood pressure. And then abnormal sweating. Sometimes it's too much, sometimes it's too little. And then heat intolerance. You can't stand heat. Just standing in the sun. Of course, now presently, especially in Malaysia, is way too hot in the afternoons if you go out. But under normal circumstances, people who cannot stand heat. So this could be a reason. Digestive issues, especially to do with nausea and then bloating and constipation or diarrhea. Now, when you think about it, you'll be always thinking of something else being the reason, and it could be because of your nerves, all right? Urinary problems, okay, difficulty emptying your bladder, and then incontinence, and also sexual dysfunction. Right? All this, all because your nerves are not functioning well, right? And also your vascular system, right? And also even the heart rate irregularities. So now even your foot and skin can have complications. Your wound, it doesn't heal as fast. It's a slow wound healing. And then there are frequent infections, especially like food ulcers, especially in diabetes, right? And then skin dryness or cracking. And then you have loss of pain warning. Injuries go unnoticed. You're injured, but you don't feel the pain because something is not going right? And then risk of amputation. Certain cases, the wound doesn't heal, it goes on to become gangrene, and then the doctors are recommending amputation, right? And all these people having this problem, they go through daily life challenges, right? They have poor sleep due to the pain, and then they have reduced mobility, and then difficulty holding objects, a higher risk of falls, and anxiety or depression. So all these problems people go through. Now, if you know anyone having this kind of problems, then you should be telling that this could be the problem, neuropathy, right? So and then reduce independence, where now they have to depend on people, okay, and a lower quality of life, right? Now, what are the causes of neuropathy? Why suddenly the neuropathy? First of all, it's diabetes, the most common cause, right? High blood sugar damages the nerves and blood vessels, right? And then it's known as diabetic neuropathy. Okay, so cut down the sugar or cut off the sugar completely, then you have an opportunity to reverse the problem. And then it's also because of poor blood circulation. High blood sugar damages the nerves and the blood vessels, and then probably you're not drinking enough water, so the viscosity starts going up. It's also known as diabetic neuropathy. Vitamin deficiencies, right? Especially for whom? For those who have a vitamin B12 deficiency, B1, B6, vitamin E deficiencies, and malnutrition or poor absorption. On one case, it's you're not getting the food. The other case, there is food, but it's not being absorbed properly, right? So also now, presently, especially if you're in the cities, the toxins and the chemicals which are all around us, and then alcohol abuse, heavy metals. So, practically all the products now containing them, and industrial chemicals, right? And certain medications are also affecting us. And the medication side effects, right? You take medication in true honesty, where you listen to the doctor, but you find that they have got side effects. And these side effects are causing you problems, okay? Especially the chemotherapy drugs, some kind of antibiotics, and then certain antivirals or heart medications, right? So you are taking them to treat yourself, but you're also giving side effects where they're affecting you, right? And infections, you have infections like shingles, right? And then HIV, Lyme's disease, okay? Hepatitis. Lyme's disease is caused by an insect, and it's very difficult to treat, right? And then COVID-related nerve complications, right? All these infections can also cause you a problem. And then autoimmune diseases. Many people are now suffering from autoimmune diseases, not knowing what the cause is, right? So the immune system attacks nerves, first of all, like lupus, rheumatoid arthritis, and then Guillain-Barré syndrome. Basically the body, the immune system attacking peripheral nerves, right? And then you have chronic inflammatory neuropathies, right? So this all affecting people. Physical injury or compression. Sometimes you have trauma because you have had an accident. So that's also affecting. And then you have herniated discs, which are compressing the nerves and causing other problems. And then you have carpal tunnel syndromes. You have repetitive strain. You keep doing extreme. Now, people train, they do exercise. So the people do say that you can train, you can exercise, but do not go to the extreme. Because when you go to the extreme, you have repetitive strain. Eventually, it might affect you in the long run, right? And tumors pressing on the nerves is also causing problems. And then there are also genetic conditions, right? Inherited nerve disorders, right? This is a kind of disease which sort of attacks the upper body, right? The face, the hands, the chest, okay? So this is one kind of nerve disorder. And then you have metabolic and organ disorders, where you have kidney disease, liver disease, thyroid disorders, all would have started from some neuropathy which is not supplying the signals and the blood to those areas. All right? Even obesity, okay, and chronic inflammation. And aging. As you age, especially when you pass 40 and you're reaching 60, and especially when you pass 60, right? Natural nerve degeneration happens over time. Okay, reduce circulation and repair capacity. Okay, there are things in the body where by God's design it has been cutting down, because otherwise you will remain immortal, right? So it slowly diminishes, but then if you know what to do, of course you can overcome that. You can age gracefully, right? And how neuropathy actually damages the nerves? How does it work? So if you look at this is a healthy nerve, right? You have what is called an axon, and then you have these blood vessels, and then you have the myelin sheath, right? So these are normal, healthy nerves. Now what happens is, over time, nerve damage can begin due to the various things I mentioned above. So the high blood sugar, toxins, and inflammation are one of the worst. So they cause this myelin damage, covering it. So the myelin starts to break down. Then what happens is you get impaired signals, right? So now, because the myelin sheath is broken, the signals are not able to travel to the axons. There's leakage. So you start having pain, you have numbness, you have weakness, and the brain gets abnormal messages. All right? And then what happens if there's nerve degeneration, right? Where the nerve fibers start dying, there's decreased blood flow, and then the axon becomes exposed, the signals are not traveling through, so the nerve fibers deteriorate and die. So you have neuropathy. So this is the extreme case. Now, of course, it would be wonderful if you want when you in the first stage, when you find that there's something which is not right, you can reverse that and bring it to this. Right? So that's what we are hoping for. Right. So neuropathy and the vascular system. Now, this is the vascular system. This is the normal blood flow. All right. Now, what happens is when there is constricted blood vessels due to nerve problems, the signals are not coming properly. Now you have reduced oxygen and nutrients. So you have reduced blood flow. And eventually, because you will have a lack of oxygen because of the poor circulation, and you have tissue damage. So this is where wounds do not heal, people do not recover, they start having pain, they start having all kinds of complications. Right? So this is again the normal myelin sheath, and this is how it degenerates. The nerve becomes damaged, and you start getting neuropathy. And this is how the progression happens, right? There's nerve damage, numbness, and then severe complication. And this is the difference between nerve regeneration and degeneration. Now, when you say regeneration, now basically the body is designed where these nerves can regenerate, which means that they can reverse what's happening and become better. But for that, you've got to do something, all right? There are many things which you can do, of course, many ways, all right? So, but one of the ways which we can do, all right, when you have neuropathy issues, to overcome them, you can use our blowers, you can use our bio, you can use our BioLite, and then when you're blowing or using them, especially the bio and BioLite, it works through your feet and you start having relief. Right? So use them. Use the bio, use the BioLite, use the blowers, and you'll find that the relief comes and also you have long-term recovery. You start regeneration and slowly it's turning back, right? And you are changing your life, you're changing your health, and you're finding that now you're able to walk better, and the pain is getting less, complications are getting less. So what happens in the body is starting to get more blood into areas where it should. Oxygen is moving into areas where it should. You're getting more energy, more hydration. And when the cells receive those, they start regeneration. And you will find that in 1 year, 98% of you has become better, right? And now you're able to do things which you are not able to do before. You have a new you. So don't waste any more time. If you have the device, start using it. If you have been keeping it aside, if you do not have, you should probably think of getting one. If you have the blower, start using it and bring back recovery to you. All right? So with that, I thank you.